Who teaches us to play the game of dentisting basketball? Dribble, pass, shoot. Dental school usually does not teach us how to really survive and thrive in the real world of dentisting. It'd be like learning just how to dribble and not shoot before you went out and played every day. I'm here with Cam Harris, one of the co-founders of Ripe Global. He spent some time with us in Philadelphia. He's from Australia. First question, Cam, is what have you thought of your experience in Philadelphia? The food good, the walkability? Tell us about that.
Hey, look, I'm really excited to be in the United States, particularly in Philadelphia,
Thanks.
and your hosting's been marvelous. And today we had the opportunity to have steak.
Yeah, cheesesteaks.
Cheesesteaks is absolutely fantastic. Pizza, some great meals. Probably what's even better, though, is that some of the clinicians and clinic owners and people we've chatted to has just been an enlightening conversation.
I love that. I mean, we stand for food, friends, having a great time. We talk about learning, laughing, and being less annoyed together. You've met practice owners who own multiple practices. You've met the Nacho team.
Yeah.
Share with our audience what Ripe Global is dedicated to doing. I put on the screen here, better dentisting, faster dentisting, confidence, competence. Tell us more about that.
Yeah, I mean, look, if we get out and talk to dentists in the United States and in Philadelphia, we went out to some clinics this morning, and there's just a consistent theme of dentists passionately committed to being better dentists, doing better work for their patients, increasing the diversity of the procedures that they're trying to get to. Fundamentally, there's this need to have access to resources and tools to help dentists achieve their career objectives. And so Ripe Global, which we've been talking to you about, is a destination for dentists to go to, allows a dentist to establish where they are in their career, either inspire them or help us understand where they want to go to and achieve in their career.
For sure.
And then to provide the tools and the resources and the learning and the mentoring and the community, everything they need to go through that stepwise uplift to get to the maximum production and success that they possibly can.
One of the things I'm inspired by is our motto is ABC to FLA, always be connected to feel less alone. And it's easy to feel alone as a dentist. I also want to point out this time, I'm the only dentist on this Nacho TV show. You did not go to school to be professionally weird like me. Your brother, Lincoln Harris, my friend, you guys are friends and sponsors. But just tell our audience, you work with Link. Link's the dentist. Yeah. Your business background. What is your role at Ripe Global? And a little bit about your background.
Yeah. So in Ripe Global, we sort of got the left brain and the right brain. I'm not sure which one the dentist is, but the reality is that to really unlock the potential of the dentistry, we need amazing dentists that can mentor and lead people that want to reinvent their career and their clinical journey. At the same time, there's a very big business aspect, which is around, how to mentor and coach people, how to, assess the capability of people and where they go. So my background, I'm the CEO, Managing Director of the Ripe Global Group. Lincoln that you speak about, he's the CEO of our clinical education, head of faculty. And so in my role, I get to talk to a lot of dentists and group practice owners about how to unlock the production of their people. And that's really the focus for me.
It's really about feeling better, dentisting better. I mean, Link talks about it. The morale of dentists can be at an all-time low. Through the pandemic, they haven't gotten the reps. Through the pandemic, there's been all kinds of challenges. One thing, you gave us a magnificent presentation. And one of the four-letter words to dentists, Cam, is sell. And I say, if it doesn't help, it doesn't matter. So the implant overdenture I'm going to do, it's going to help my patient dentist chew. So it's going to help. And then I am proud to sell that help. You put on the screen, if you don't believe in what you're doing, you can't sell it. But why do you think dentists have this hang up about selling? You can't be successful unless you sell things, but this is a big problem. In interacting with us professional weirdos, tell us a little bit about that.
Yeah, so I'm struggling with the word weirdo. At the end of the day, if you look at my background, in every business that exists, you have people, which are in our world clinicians or doctors. We have customers, in your world, the patients. You have a place that you kind of get together to do business, and in your world, that's the clinic or the operatories that you're operating within. And then you have a product, and in the dental world, your product is your procedures, and that is just the way it is. The thing is that the associate doctor or the doctor themselves are both the inventor, like the manufacturer, the supply chain, the producer, and the customer service, and the salesperson.
That's why I brought. This is what it feels like to be a dentist on the inside. Sometimes, Cam, we have to keep our crying on the inside, sweating on the outside.
So it actually looks a bit like LinkedIn. Actually,
So last night we went to dinner with a group, and you know what's crazy is we go to dinner,
Yeah.
we order the food, we pay the bill, and we say, thanks for having us.
100%.
That was a great experience. And maybe we can put some of that into dentistry
No doubt.
and make it a way for dentists to understand that without running your business right, you can't do anything else right. Next thing I want to ask you is, I've been a dentist for 20 years. You have to travel for CE. Tell us how Right Global allows the dentist to learn from their operatory.
Yeah. So if you look at the way we thought about advancing clinical kind of competence and capability with dentists, we talk a lot about confidence and competence. So confidence means you feel you can. Competence means that you should.
Right. Yeah.
We really want to join the should and you feel you can together, so you're both confident and competent. And historically, that's always been to go and do some continuing education, some CE, where you go to a place in a moment in time and you do this condensed sort of uplifting of skills and capability, which we just don't think that's super effective. In fact, it's not effective. The second thing is that the biggest cost of education in that context is the downtime of the chair, the $2,000, $3,000, $4,000, $5,000 per day for travel time, and when you're out of clinic, plus your travel costs as well. So instead, what we do is we have the world. The cloud is our campus. Our classroom is your clinic. We send a simulation lab to every one of our learning dentists. They sit that simulation lab with amazing models. In fact, I think some of the best models I know that you've ever seen.
Yeah, for sure.
That we've had custom
It mimics what it's like to work on a patient. I know it's your joke or Link's joke, but I have done implant teaching for years, and we do not work on many pigs. That is your joke.
Work on pigs.
And this is what you can do, dentist. Whether you're a practice owner, whether you're an associate, whether you're a new dentist, dentist, you can learn from your operatory. I explained it to my awesome wife, like learning how to cook using the things that you have in your kitchen.
No doubt.
The next thing I kind of want to go through is the Right Global Continuum. You can do it for 24 months. You can do it for 6 months. You can join online. You, like our nacho group, you have a lot of toppings. So kind of just break down the 3 major toppings people can learn.
Yeah, so there's actually 4, if I'm correct. Sure. Yeah, so we call it a virtual dental residency. It's something everyone understands. So it's intense. It's over a period of time. Lots of practice, repetition, and real simulations. The 6-month module or the 6-month program or structured pathway, which is all about posterior dentists, mastering the art of volumes of units, getting crowns to be very, very high quality, great clinical photography, using good clinical photography equipment, treatment planning and diagnostics. So it's really about the posterior.
And back teeth dentistry is most of dentistry.
It's the biggest
volume. Even though Link can post these wonderful Instagram cases, the thing that we are doing day in and day out is back teeth dentistry. So if you're an associate or you have an associate that you want to help become better and faster with this, you can text yes to this number 215-543-6454. So this residency, and in the US we call these GPRs, AGDs.
Yeah.
It's in your operatory. You have these amazing instructors. You create camaraderie with the group that you're learning with.
Yeah.
It's anytime learning. They hold you accountable. But now for a dentist out there who wants to do more, full mouth rehab, implants, can they also do that?
Yeah, absolutely. So within the residency for restorative, it goes through posterior, aesthetics, veneers, and then full mouth rehab. And even if people don't want to do full mouth rehab, they do the first 3, will make you a much higher producing clinician, do great things for patients. The typical pathway at the back of that, including in your restorative dentistry repertoire, is the movement and occlusion elements and getting into orthodontics. We go right through to class 3, malocclusion, and we incorporate both sleep and breathing into that program. So you can really focus on the whole health of your dental patients. And the most recent addition, which will be soon be added by full surgical and complicated extractions, is our implant program, which is to take you all the way to full arch implant dentistry and then have you extend then into live patient somewhere in the world with one of our partner live patient facilities.
And awesome. As we wrap up, I've saved the best for last because Jim Collins, Good to Great, the right person in the right seat on your bus, getting the right person for the right job, and hiring is difficult. And many dentists out there, we run Dentist Job Connect, say, how am I going to know if my associate is the right one for me? And there's a real problem with this, to be honest, Cam. You don't really know how to test these people. You created this assessment tool.
Yeah.
Tell our audience about this assessment tool and how it can help them identify strengths, opportunities for improvement, and also use it as a hiring tool for their associates.
Yeah. So officially, we're in the just final releases. So it's the 11th of March, to hold people back on the assessment too. So our clinical development tool is a tool using a global, very large data set to enable a dentist to, within 10 minutes, go through all of the things that make a great dentist, and benchmark them against what is a known master dentist and where they are on that continuum from graduation to mastery, and then give a prescribed outline of the things that they will need to do as an individual to uplift their
And what I think you guys should do, and remember, March 11th, it's coming up, so it's not yet, but it's a treatment plan for their success, right?
No.
So we make treatment plans for our patients, customized ones to help them, not someone else. So it's not a judgment, it's an opportunity to get them on the right track. And we do not get, and one of the reasons, Cam, is that medical doctors hang out with each other all day. And they're walking around the hospital saying, I did this procedure, I could do this way. Us dentists, I mean, Dr. Ben Burris, Dr. Chip Payette works oftentimes solo practice owners all by themselves. So this is a way to really bring, whether it's large group practices, commonly known as the DSO, whether it's a small group practice, this is a way for you to get that right associate. Well, Cam, you've been an awesome guest here. We've had a lot of great food. You're coming back in April. Is there anything you want to leave our audience with before we wrap?
Hey, listen, look, it's really exciting to be here. And Paul, thanks for hosting us. 11th of March, some amazing things are happening. If you have associates in your group or you are an associate, you're really interested in fast tracking from where you are today to where you want to be, reach out. You've got a number on screen. Reach out to the Dental Nachos. Go to rightglobal.com, the destination with the tools, resources, mentoring, learning, and everything you need to unlock the power of your maximum production. So can't wait to talk to whoever is interested in making it big in dentistry.
Awesome. I know, my dream was to play in the NBA. That dream failed. Maybe if I grew as tall as you, I would have made it. But this backup dream of bringing dentists together, having fun, reach out to rightglobal.com, dentalnachos.com. We are here to help you. Thanks, Cam.